The recording has now started, Kathy.
Good morning. This is Kathy Glazer, President of the Virginia Early Childhood Foundation. Over the next hour or so, we'll be recording a briefing for early childhood stakeholders that will then distribute statewide in an effort to bring timely and relevant information to our colleagues and partners related to the COVID crisis. Please note that updates and guidance from state officials are emerging day by day. This call will contain information as of 8:30 this morning. We recognize the cascading impact from the virus and the strain it's causing, and we're especially concerned for vulnerable families and the providers who partner with them in caring for and supporting young children. We're hearing from many of our local and service partners who are struggling to provide appropriate response and supports and need information and guidance to help discern solutions that are practical, feasible, and ethical. As we strive today to provide these important details and updates from state agency colleagues about early childhood programming, services, and resources, I'd like to start with some triaging of priorities that provides a compass for me and for the Foundation as Virginia grapples with these issues, especially over the next month as the world is trying to flatten the curve of the coronavirus spread and impact. First, health and human life. We should take immediate action to protect everyone, including early childhood professionals like early educators and home visitors. Next, economic impact. We should buffer losses and gaps from the crisis for the livelihood of individuals and businesses, large and small, including the child care industry. Third, we should ensure critical supports, especially for vulnerable families and for early childhood service providers, including food and nutrition, mental health needs, and special education needs. As we all know, the early childhood system, and I'm using air quotes there, is complex, and these priorities are riddled with ethical dilemmas. To ensure that the Commonwealth of Virginia responds as swiftly and effectively as possible to the COVID crisis, the Foundation has made specific requests of the state. First, the Governor and Health Commissioner should appoint Jenna Conway, Chief School Readiness Officer, to coordinate across state agency leaders Virginia's thoughtful and comprehensive response related to early childhood services. Next, Virginia should call for and strongly encourage child care centers to consider closure for the next several weeks, similar to the mandate for K-12 schools, out of deference for the health and safety of early childhood teachers and staff. At the same time, the agencies should work to ensure proper protections for these small businesses and individuals, including continuation of payments, access to disaster relief, and to unemployment insurance. For parents impacted by these closures, employers and public programs should do all possible to help these parents stay home without loss of income or benefits. Employers who need parents at work to sustain essential operations should work with local agency, community leaders, and providers to identify child care solutions that limit risk. And lastly, Virginia should quickly and thoughtfully develop a plan for child care for essential workers, including first responders. For those child care programs and staff who are counted on to provide this service, and they become essentially first responders themselves, there must be commensurate compensation and additional guidance and supports for on-site practices that will reduce the risk of infection and protect both the adults and children who interact in these settings. In the meantime, we're very grateful that several agency leaders who've been diligently working to be responsive to the crisis have taken the time to be with us to provide updates about specific actions and guidance for Virginia's early childhood programs. We have Jenna Conway, Chief School Readiness Officer, a dual appointee from the Governor's Office and Department of Education, and from the Virginia Department of Social Services, we have Sharon Lindsay, who is Associate Director for Legislative and Regulatory Policy, and Barb Newland, who is the Director of the Division of Child Care and Early Childhood Development for the Virginia Department of Social Services. We'll hear their reports and then ask them to respond to a few questions and then hear their thoughts about how early childhood stakeholders can help advocate for and support Virginia's collective response. We're also joined this morning by Dr. Julia Murphy, who is working with the Department of Health team that has been formed to develop community mitigation strategies, and she's participating today to learn more about issues related to early childhood programming in order to incorporate that into the team's strategies moving forward. I want to welcome each of you to the call today and let you know how deeply we appreciate your efforts and your taking the time to be with us today. At this point, I'm going to turn it over to Jenna Conway.
Thank you, Kathy, and thank you everybody for joining us for this update, this very important update. I'm Jenna Conway, as Kathy introduced, and I'm our Chief School Readiness Officer. It's always a question of kind of what does a Chief School Readiness Officer do? At a time like this, you sort of move away from kind of the broad focus on sort of strengthening the system to, as Kathy alluded to, triaging and thinking about how do we, across the various agencies and branches of government, work together to keep safe, reassure, and sustain our youngest, littlest learners, as well as the families that support them, the providers, and the community. And so I'm very glad to be here this morning and to take you through, as of today, March 17th, our update from the state perspective. Val, can you move to the next slide, please? So what we would like to cover is provide an update on where we are in terms of COVID-19 in Virginia. And as Kathy noted, and as you might imagine, this is an evolving status, but wanted to provide a brief update. Talk a little bit more detail about COVID-19 and what we know about early childhood, how this sort of affects that system. And then in more sort of detail, talk about home visiting, early intervention, licensing, subsidy, Head Start, our pre-K in the schools, and then end on child nutrition. Throughout this, we'll provide detail as we know it today, both share what we're doing as well as speak about supports that we would like from the field. Together, it will take a kind of collective response in order to truly support our kids, our families, and our communities. And so we'll take you through that. We'll also provide detail about if there are specific questions who you go to during this kind of point of crisis. If there are concerns overall at any point, feel free to email me and we'll provide email information at the end. But we've also got email addresses throughout, so you know who, if you have a very specific question, you know who you can contact. Next slide, please. So as of today, March 17th, there are 50, it's actually been updated even in the last hour, 51 presumptive positive cases of COVID-19 in Virginia, right? So it is upon our state. We've tested over 500, although the department is no longer tracking that because private tests, and we've already had 2 individuals in the state that passed away. So this is at the kind of point where we've moved from this is coming to the state to its full bore here. As we have noted, this is a rapidly evolving public health situation, but we want to kind of go through what has occurred most recently. So on March 12th, the governor declared a state of emergency with Executive Order 51, a detail that kind of provides some flexibility for the state to be able to respond to this crisis, sends a clear message to our communities that this is in fact a pandemic and we need to take it seriously, and provide some flexibility to the agencies. And sort of since then, our state agencies have been working to figure out what are the needs of our communities and how do we respond to them. On Friday, the governor ordered the closure of all public and private K-12 schools for at least 2 weeks, including preschool classrooms in those schools. We also know that folks had started closures before then, and many school divisions have closures that go beyond that go into early April. So really trying to kind of close down schools, encourage social distancing, and then work with those communities to figure out how do we support parents and kids during this time. As the situation continued to escalate over the weekend, the governor banned all public meetings of 100 people or more as of Sunday. And we have heard word this morning, and folks should know on Facebook Live, I guess by the time people hear this might be dated, but he is going to provide another update today. And as Kathy noted, we will kind of get this guidance out to people as it comes up. So as you can see, this is rapidly evolving, and day by day, we are trying to kind of get guidance out to the field. One of the ways that we will continue to need support from stakeholders is really helping to kind of promote that through all channels. And so the governor is using press releases, press conferences, Facebook, other kind of common sort of means of communication. But we know that that doesn't mean that this kind of gets to every last individual, in particular every last individual in the early childhood system. So encouraging all of our stakeholders as updates come out from the state to kind of share them with your email serves, on your websites, on your Facebook or Twitter account, so we can kind of continue to get folks up-to-date information as this is changing day by day, if not hour by hour. Next slide, please. I think before we get into the detail of responding in terms of what the state agencies are doing, I think it's important to speak about kind of how this just generally affects early childhood coronavirus, or this version of the novel coronavirus, COVID-19. The CDC, or the Centers for Disease Control, continue to be the best source for the health information nationally. Obviously, the Virginia Department of Health for the state and local departments of health in terms of kind of what's happening in my community and what are the health implications, and really kind of encouraging people to use those resources. Thought we would summarize kind of what we know about COVID-19 in early childhood in terms of both sort of the impact on kids and then what that might portend for the broader early childhood system. So I think a key point to note is that according to the best research available or evidence available, children do not appear at sort of greater risk or more vulnerable for COVID-19 than adults. So there have been kind of in the global pandemic, some children and infants that have been sick, but adults are most of the known kind of diagnosed cases. Symptoms for COVID-19 are similar in children and adults. However, generally speaking, children have presented with mild symptoms, including cold-like symptoms, fever, runny nose, and cough. A little bit of vomiting and diarrhea. It is not known yet whether some children may be at higher risk for severe illness, if it's, for example, children with underlying medical conditions or special health care needs. So always from an equity perspective, we're thinking about who is most vulnerable in terms of the children across our early childhood system. How do we make sure to keep them safe, their families supported? And just wanted to be clear that it's not kind of evident whether or not there's a greater risk for kids. That said, there is some evidence that adults who care for or work closely with children may be vulnerable. And there's particularly some concern about adults, sort of older adults and adults with underlying illnesses. I think that's where you start to see potentially some implications for Virginia's early childhood system, kind of beyond sort of our first triage, which is making sure we're keeping our kind of kids safe, right? Our sort of vulnerable kids safe, kind of taken care of, making sure that health, safety, and welfare is sort of a primary concern. Secondarily, we know that we do have a workforce in terms of our, whether it's our preschool teachers or our child care educators, who could be vulnerable. So for instance, we know based on recent workforce survey results that we have a significant proportion, 1 in 10 of our child care educators who are over the age of 60 and a quarter who are over the age of 50, right? So again, a population that we're going to want to be very thoughtful about when it comes from a health and safety perspective. We don't have data or kind of extensive data on underlying health conditions, right? And so again, an important note is we're sort of thinking about balancing health, safety, and welfare of children and adults kind of across the Commonwealth, noting that we don't have as much sort of information on that. And so we're trying to kind of balance that as we think about things like closure. In terms of interim guidance for childcare, noting that we, as sort of said earlier, we've already had sort of a wholesale closure of our K-12 public and private schools. The Virginia Department of Health has put out some interim guidance for childcare. And I think, as Kathy alluded to, that is the kind of the key question that we've heard has been coming from the field. We've closed K-12 schools for a minimum period of 2 weeks rather, for both public and private schools. What about childcare, right? And what about this kind of balancing act between how do we make sure our kids are taken care of, their health, safety, are, making sure that we don't have kind of kids left alone during this time, but also I think the health, safety, and welfare generally of our early childhood workforce. And so we know and understand, and you'll hear us throughout the day, are working to kind of provide additional guidance that follows the governor's executive order for schools about how we should be kind of thinking about closures in childcare. the other kind of key point throughout this is no matter where you are, whether you're, sort of at home or in a center, in a family day home, parents are scrambling, I think it's important to note that, beyond health, safety, and welfare, the most immediate need, if we triage, is that our kids are all going to experience this. And so, and in some form or fashion, this represents a kind of a pandemic or a disaster for kids. And it's important to kind of keep in mind that they're observing us, they're a part of this, and continuing to support their coping skills and mental health throughout this time remains critical. Another place where we are going to continue to need our partners' support, right, beyond the immediate triage. How do we make sure folks are healthy and safe? How do we make sure that folks sort of are financially secure? How do we make sure that we're supporting folks, sort of mental health as well? Next slide, please. So with this, what I'd like to do now is to get into some of the detail about what's happening in the various areas. As Kathy noted earlier, this is an update as of the morning of March 17th. These things are rapidly evolving. Folks on the call today have been on the phone throughout the weekend. We know that that there's a lot of conversation. We're learning more as this kind of unprecedented pandemic sort of takes place or sort of shifts across the state. But that said, we wanted to kind of give you the up-to-date information as we know it this morning. So in partnership with Early Impact Virginia, our home visiting programs have come together and are shifting to a virtual or telehealth model to the extent feasible for at least 2 weeks. And so kind of a real sort of focus on like, how do we balance between supporting our most vulnerable families, our sort of pregnant women, our new moms and dads, right, our kind of children with special needs, but shifting away from kind of in-person activities that could expose either our families or expose our workers to kind of more telehealth or virtual. They've got some model guidance that they're using, and they're kind of adjusting their service delivery to reflect telehealth when social distancing is recommended, and also being kind of very thoughtful about technology, right? So that we know that some folks might not have access to a laptop, so thinking about, do they have a phone? Can we use a phone? What is the way, knowing that we have kind of a digital divide in terms of access to technology. Early Impact Virginia has been in communications with the Department of Health and Social Services, and is working very closely with programs to make sure that we've kind of dotting every I and crossing every T, so we can have resources flowing out so we don't have to stop home visiting. And we're continuing to coordinate with partners to sort of problem solve around, okay, here's where our telehealth or virtual approaches are working, and here's where there are challenges. So if there are kind of questions, concerns, or you're hearing from either home visiting programs or from families who are participating in home visiting, or if you say, I know kind of a mom that would be interested in this, don't hesitate. We have not stopped home visiting, right? We've just shifted models. And for more information, you can contact Jackie at Early Impact VA, who can then resource out to the network, to the various sort of 10+ programs across the state. Next slide, please. Early intervention, so huge thanks to the Department of Behavioral Health and Developmental Services, Catherine Hancock and team. So early intervention is our, generally speaking, home-based program supporting our vulnerable families and children 2 and under who are experiencing developmental delays or have other special needs. Again, we are looking at a shift in programming here. The state has urged all our early intervention providers, a lot of whom work through our community service boards, to follow some of the federal guidance on adapting to assure continuity of services. So knowing that, families really rely on early intervention in terms of kind of supporting their kids' learning and development. There's some guidance online there, but basically the state is encouraging their providers to use their judgment to really think about how, if it's not safe, to kind of go into homes, right, either safe for families and kids, knowing, as we sort of noted before, we don't have evidence that more vulnerable kids are at higher risk, but, better safe than sorry, and also for kind of our providers. So looking at how you can assure continuity of services, taking kind of case by case based on sort of where the child is at, sort of how the family can benefit, thinking about virtual kind of teleconferences or alternative options as well as kind of looking at alternative locations. So a lot of flexibility here. Most often, folks are served in the home, and so really thinking about kind of, again, some version of teleconference to sort of support activities, providing, a lot of times early intervention folks go in and sort of model the behaviors, and so thinking about whether it's using a phone or FaceTime, but figuring out how they can model those behaviors and support mom or dad or guardian to kind of mimic that behavior and carry on the activities with kids. So again, not shutting down early intervention, but kind of moving to kind of different alternative models, documenting that carefully. If there's any questions about sort of from families or from our providers across the state on how to do that, please reach out to Stephanie at the Department of Behavioral Health and Developmental Services. So you see kind of a trend there, shifting away from in-person services, but not discontinuing, and really sort of thinking about kind of meeting families where they're at and providing kind of, virtual or telephonic services to continue to meet the needs of our most vulnerable infants and toddlers across the state. I should note, there also are, if there's sort of places that are closed, right, we're kind of, we're trying to kind of make sure that we're tracking that. With office closures, it is more difficult to kind of sustain these programs, but I do know that sort of state agencies, local agencies, CSBs, everybody's kind of in this model of moving to kind of telework with their employees and then providing more virtual or teleconferences services. Next slide, please.
Hi, folks. This is Sharon Lindsay from the Division of Licensing at the Department of Social Services. Wanted to share a few updates on some of the responses that we have prepared within the Division of Licensing. One of the paramount things that we're doing right now is trying to determine which child care programs have closed and providing this information to Child Care Aware, who is our statewide resource and referral agency, so that they can better inform families, particularly our first responders, medical professionals, frontline staff who don't have the ability to work at home. And we want those folks to be able to have child care resources available to them. So we are gathering this data, providing it to Child Care Aware on a daily basis, and trying to make sure that folks are informed about the programs that are not able to stay open, but more importantly, perhaps where they can access available child care for their families. We also are beginning to reach out to our hospital-based child care programs. We actually have regulatory authority already to do this. Hospital programs can be available to increase their capacity with the department's approval. These are established licensed programs connected to hospital programs, and so they have demonstrated health and safety compliance, and we are hoping that these might be a resource for some of our first responders if there are available slots. And lastly, we are culling through our regulatory requirements and trying to determine which might be requirements that could potentially be waived with the governor's approval, things like training, paperwork, certain documents that have to be collected from either children or staff as they begin enrollment or begin hiring at a program. And we're trying to get that list to the governor's office as soon as possible so that we can determine if there might be some flexibility allowed.
Okay, if we could advance to the next slide for the Child Care Subsidy Program. This is Barb Newland. And so our update today, the Child Care Subsidy Program, which is administered by the Virginia Department of Social Services and the 120 local departments of social services, will continue to operate through this challenging period. Families are encouraged to apply through Common Help and to upload their documents through the Common Help site if that is helpful. And this applies not only to the Child Care Subsidy Assistance Program, but for all public assistance programs such as TANF or SNAP. The address for Common Help is commonhelp.virginia.gov, or you can find it just by Googling Common Help Virginia. I will share that I believe that all local departments of social services are operating at this time, although some may have restricted public access, but staff are working either on-site or are working remotely. Regarding the subsidy program, the face-to-face meeting for initial eligibility for subsidy will be temporarily suspended. The department's in the process of modifying several aspects of the program to address the needs of families, child care providers that work with the subsidy program, and workers in the local departments of social services. These temporary program mods will address full-day authorization for school-age children, increasing paid absence days, enabling sibling enrollment, modifying annual attendance submission procedures, and some other areas. A COVID-19 page, which will house FAQs and ongoing updates, was added yesterday to the Virginia Child Care microsite, www.childcareva.com, and that will be updated regularly and frequently. The FAQs regarding the subsidy program should be posted there tomorrow. And for more information, please feel free to contact Sherry Dorsey, the subsidy program manager, and her email address is shown, sherry.dorsey@dss.virginia.gov.
Excellent. Thanks, Barb. Again, kind of appreciate the update rather on the child care licensing and the subsidy program. I think as noted, we're trying to kind of respond as a state, right, to these really sort of dual challenges to balance. On the one hand, sharing health, safety, and welfare, right, of both our infants, toddlers, our preschoolers, and our kind of K-12 kids, right, who are out of school and in the system, with that of all of the adults in the system, our educators, our caregivers, our janitors, you know, and kind of to keep folks whole, and so really kind of encouraging families to use common help. They're not comfortable going into kind of a local office. So all local offices are open, but kind of available virtually, if not in person. And then, as both Sharon and Barb noted, more guidance to come really over the course of the next 24 to 48 hours on these programs, thanks to some of the flexibility provided by the executive order that agencies are able to kind of react and respond to needs. If we go to the next slide, we'll talk a little bit about Head Start and then shift into preschool. I should note as we shift and sort of kind of understandably the question comes out, well, how are we keeping some of these programs open and afloat and closing others? And I think it's just important to note this is the dilemma that we at the state are grappling with. You know, it is important to say, right, that child care is, and as kind of Kathy noted, these folks are both first responders and the last resort, right? And so in order for us to keep hospitals open and operating, you know, I've heard estimates anywhere to a quarter to a third of our nursing personnel are parents, and maybe potentially up to half of those are single parents, right? And so that kind of childcare has to be available if we want to have nurses around the clock to support this pandemic. I think we know we've got first responders, right? We've got society to run, and so whether it's police, firefighters, other pieces, we also have the kind of essential personnel, and this is probably the most broadly defined, but everybody from sort of our sort of sanitation staff to folks who staff grocery stores and gas stations to our sort of state employees who are kind of, making sure that folks are getting these benefits, as Barb just described, or able to kind of open new new childcare programs at hospitals, as Sharon described. And so trying to kind of balance as a state, how do we kind of keep folks home when possible, and social distancing, but also assure that childcare, which is absolutely the last resort for families of children across the state, is able to operate to support those essential personnel, so that we can kind of keep, sort of society functioning and folks healthy, throughout this process. With that noted, just a few updates on Head Start. This is mostly based on the federal guidance distributed last week that kind of provided to programs. Again, our understanding is most Head Start programs in schools, although not explicitly included in the order, are closed because they generally operate in a school setting, and in our K-12 schools are shut. Head Starts that operate outside of schools, are allowed to remain open. Many have closed temporarily, and the Office of Head Start is advising kind of grantees to consult with their local authorities to use the CDC triage chart to make determinations on closures. But we understand that, again, that's kind of case by case. The Office of Head Start is sort of both deeply concerned about families and has provided guidance there, but also about Head Start employees, educators, family support specialists, and is directing programs to continue to pay wages and provide benefits for staff who are unable to work during closure. So again, kind of addressing health and safety first, but then looking at how to sustain this really important workforce. Programs have also been encouraged to kind of stay in touch with families, to think about delivering services remotely. So one of the strengths of Head Start is that it's comprehensive services, but similar to what we hear about kind of closures of schools, one of the challenges is sort of whether it's food, nutrition, kind of family support services is really, again, sort of similar to what we see with early intervention and with home visiting, encouraging our programs to deliver services remotely, via telephone, or virtually to the greatest extent feasible. Head Start programs are permitted to provide meals and snacks during closures. We also know that many Head Start programs are also working very closely with their school divisions around kind of distribution sites across communities, and I'll talk a little bit more about that at the end. We do have a new Head Start collaboration director for the state, and if there are kind of specific questions about Head Start, please don't hesitate to reach out to Tondwa. Next slide, please. Virginia Preschool Initiative, and basically this is sort of a general kind of umbrella for all of our preschool programs in the schools. As noted earlier, the governor's executive order closed all K-12 public and private schools for at least 2 weeks. This was intended to include all preschool programs in schools, and so our general understanding is that all VPI and preschool programs in schools are included and are closed. Right now, we are working very closely with the state superintendent and superintendents across the state to kind of ensure that there's sustainability for these programs. And so automated payments will continue and educators will be compensated. VPI programs that are operating outside of the schools are allowed to remain open. Pause 1 second.
I'll just note for folks that Jenna is home with children, and this is likely the reason for a need for her to pause momentarily. She'll be back shortly. This is real time and reality.
Thank you, Kathy. Yes, and I am back. So our VPI programs that are operating outside of school, so there's a small number of our classrooms kind of across the state, and those are permitted to remain open, again, kind of case by case. And then our sort of general rule of thumb here is that licensed programs should continue to follow guidance provided by the state and by Department of Social Services. We know that, preschool and sort of similar kind of infant and toddler programming doesn't really work virtually. I think we can engage families on activities to do with young children. That said, we are working kind of with our early childhood coordinators across the state to gather resources. We're doing that now, and hopefully within the next 24 to 48 hours posting that, encouraging folks to kind of learn at home, which oftentimes does not involve a screen, but instead involves a sort of a set of activities, play, engagement, really trying to provide that guidance to parents, guardians, and folks across the state. And then VDOE, similar to kind of as Barb talked about for DSS, as sort of keeping resources on its website, which is linked here, and is finalizing a set of early childhood FAQs. We'll send those out via its email list this week and post it online. If there's any questions about VPI, most of which are related to kind of funding, continuity, that sorts of thing, please don't hesitate to reach out to Erin Carroll at the department. Next slide, please. Similar to the points made around early intervention, we also are working at the department to support school divisions around meeting the needs of our most vulnerable children. So as we talked about earlier, all of our kids are subject to kind of experiencing this pandemic, right? Adults are nervous and sometimes panic, right? Sort of things, routines are changed. And this is hard for all kids, I'm included, but it can be especially challenging for our kids with special needs. And so really working with school divisions who are responsible for our kids 3 to 5 with developmental delays or special needs to kind of address their services. All of these children have an IEP or 504 plan. A lot of times if they were receiving services in the school and the school's closed, it's not possible to kind of continue those services. And so looking at how they're kind of asking folks to case by case, review those individual plans and figure out kind of what resources can be provided to families. This has been really important in terms of some of the state's guidance to school divisions, is don't just think about the kids who can easily access the internet or a smartphone, but think about kind of our kids with our most pronounced disabilities and what are school divisions doing to kind of reach out to those families, provide guidance and support, how to support some of those routines and activities, right, to support our most vulnerable kids. With that, we are also, additional guidance here is that we are, if the kids are receiving community-based placements, that those can continue. Again, as we've noted throughout, right, we know that some child care centers are closed, some are not, and so really trying to kind of work case by case to kind of understand which of these programs are open and kids are able to receive services there. I think you're also going to sort of see more of a work to sort of virtual or telephone services where possible with either a parent or an educator, probably more likely as we see increasing closures with parents. And so again, figuring out kind of where the IEP was sort of currently, what customization or changes or adjustments are needed, and then working with either the families directly or with the providers, depending on sort of who's open and who's not. And we understand that's very fluid. Lastly, and this is more of a perfunctory point, but we also know that there are sort of very strict timelines in terms of folks transferring from various programs. And so we're just asking school divisions to be cognizant of that, work with families. It's a lot of sort of upheaval and change. And so more communication to our families is really important around these times. And as more guidance comes out from the feds, the department will communicate out to divisions and to families. I should note, Dawn's name got cut off on this one, but if there's any questions about early childhood special education, those in the schools, those can also go to Erin Carroll, and she can work with the team to get you a prompt response. Last, but certainly not least, I think before kind of some of the commentary and questions, Val, if we can move to child nutrition. So as you've probably heard, sort of, because there's conversations across the country, as nearly half of our states have closed school divisions, sort of, wholesale, is how do we make sure our kids have access to healthy meals during school or center closures? And so kind of a key point to note is that the VDOE has secured a waiver and is now working with divisions across the state to kind of function more similarly to the summer food program. So really kind of being able to sort of not have to do the individualized meals for kind of particular kids, right, who are eligible, to sort of a more wholesale distribution of food for kids under the age of 18. Our local school divisions are working very closely with the State Department to get this flexibility, to kind of understand the rules and regulations that relate to that. But what we're finding is that many school divisions across the state are providing grab and go. So they're identifying sites across their community, elementary schools, middle schools, other places, trying to kind of balance the social distancing. So having folks kind of come in, be able to pick up meals. You don't have to be a student in the school, right? But to kind of be able to kind of come in, get a meal. You do have to have children under the age of 18 to be eligible, and to kind of grab and go and be able to take those nutritious, healthy foods home. We know that most folks have got this up and operational now that we're into kind of midweek. I know that was the scramble between Friday's closure and work through the weekend to get these grab and go or kind of equivalent sites up. we are encouraging, and I know that school divisions are shifting these sites based on needs of community, making sure that they're close to public housing, to low-income communities, communities that might be off the transportation grid, right? Because recognizing that it's much harder, right, to kind of not only to sort of get the food, but to make sure that you can kind of get it to kids and families, and this continues to evolve. For that reason, I would say that kind of the best resource locally is the school division website, or 211 if you've got it, to kind of find out where those sites are, because we would note from the state level, we've seen some sort of movement even day to day this week in terms of sites. We also know that our school divisions are exploring alternative routes to get food more directly to kids, right? To the families with kids with special needs. Transportation might not be daily transportation might not be an option. And so looking at school buses, looking at other kind of means to deliver food to the most vulnerable families, during this time of need. And again, that's division by division, but we know that work is also underway because, not every family can travel to a site. Again, the balancing there on kind of keeping employees safe, doing drop-offs that don't involve human contact, being kind of very thoughtful about that. At the state level, if folks want to help, or if folks realize that there's a community where there's not as robust food plan as could be, please don't hesitate to reach out to Sandy Kerwood at the department, who's helping kind of coordinate the work for the department perspective. If there are other questions related to the kind of CACFP during this time, I know folks are reporting kind of certain foods having harder to access. I know we've seen some empty shelves kind of across the state. There's questions around delivery. Please don't hesitate to reach out to our partners at the Department of Health, Paula and Conchetta. I should also note that this is evolving, and VDH and VDSS are currently working to address some of the other food security issues that are bubbling up, in addition to kind of the kids under 18, primarily using the kind of the sort of an alternative version of what is, equivalent to the summer food program. So with that, that is a kind of reaches the conclusion of our kind of area by area state updates. I think, as noted by myself, Sharon, Barb, and reflected in the content here, these are rapidly evolving areas. And Kathy, as you noted, we do appreciate feedback. Phones have been ringing off the hook, emails have been coming in, but reaching out to us and letting us know, hey, here's a pronounced or specific need in our community is really helpful as we are trying to kind of look to other states in terms of what's happening, hear from our stakeholders in terms of what's working and where adaptations are needed, and then look at kind of where we have the regulatory flexibility and the capacity to kind of act quickly and fairly and consistently across the state. This goes without saying, and Kathy, you noted this at the beginning, this is really unprecedented in terms of disasters. Personally, I've had either the fortune or misfortune to be in New York after September 11th, to be in Louisiana after extreme flooding, to be in New York after the blackout, and so have gone through some pretty significant disasters, but nothing at the kind of national scale like we're seeing with COVID-19. And so I think kind of recognizing that it's going to take a collaborative public-private effort is really, really important. I think, as Kathy also noted, while we have presented information across each of these areas, our sort of primary concerns are kind of protecting the most vulnerable, right, and really thinking about kind of where are our most vulnerable kids and families, and how do we really make the adaptations necessary to support those. And this balancing act, right, and sort of supporting childcare in particular as the last resort, right, that helps us run our system, right. And so while we have mass K-12 closures, significant other closures, really recognizing that, our essential personnel, our healthcare employees, will need access to kind of safe, secure childcare, right, supportive childcare, right, because as our essential folks are working and times become even more stressful, that often carries over into stressors for kids. And so wanting to make sure that those kids have access to, environments that are really supporting them during this difficult time. And that is the balancing act that the state is hearing from now, right? We're hearing from fields like, should we close, should we stay open, how do we manage this? And so I think you'll continue to hear guidance from us on, here's how we're proposing, here's the guidance on balancing, this sort of between keeping folks healthy and safe and sort of maximizing social distancing, but also needing to run our hospitals, to run our cities, to run our communities, right? To really to kind of assure, that everybody can remain healthy and safe. So with that, and to your question, kind of, Kathy, about how folks can be supportive, I think number one, again, kind of continuing to provide us the feedback from the field. As you might imagine, the state employees are in the flurry of meetings and activities and what to do. And so sometimes it's hard to get that direct feedback on, sort of what we've missed or where there might be another opportunity. And so we appreciate that. I think number two, getting the word out, even as you think about how you take the content from today's update, and kind of get that out to partners in the field, including those who are furthest off the grid, really important, right? Sort of saying to all of our families, make sure if you're not full-time authorized for subsidy, get to Common Health, get signed up for that, right? So as benefits come out, making sure we get folks signed up for them and they know what's available to them is critically important. I think number three is just continuing to sort of explore public-private partnerships. So I think as Sharon talked about, really we have some authority to work with hospitals around childcare for healthcare responders. I think that involves hospitals, that involves the private sector, that involves kind of in terms of making sure that we're aware of those needs and sort of mobilizing resources. And so we ask for that continued public-private partnership as we move forward. With that, I'll pause, see if either Kathy wants to jump in with questions or if any of my state colleagues want to add any additional commentary.
Thank you, Jenna. It's Kathy. I appreciate the great information that all of you have provided here today, and also greatly appreciate the contact information by program for our stakeholders to utilize and share. We also understand, the 24/7 nature of the work to try to plan and present the guidance and the programs well. We'll look forward to upcoming updates and guidance, but we'll share that we've been hearing some general trends in questions and concerns from the field. And since we had to shift today to a recorded call, I'll just mention, some of the themes that we're hearing from, and if you all want to share anything further, in addition from what you've already provided, I welcome your feedback, but also just for you to know that, kind of what people are thinking about and sort of their priorities for addressing concerns. I'd say that probably the biggest concern is thinking about economic relief for our early childhood program professionals, or programs and small businesses themselves, and for the families who are being impacted by child care closures. A lot of this is, currently stewing. I know there's information probably coming from the federal government about what's available, but also just want to, kind of impress the need and the desire for additional information and reassurance as feasible for that kind of economic relief. We also hear about folks wondering, where is there a central resource for families who are led by first responders or essential workers, or for employers of those who have essential workers that they need to get in? Is there a way for parents to understand, where there may be identified access to childcare specifically for that purpose? Just a little bit more of a kind of an information vehicle around access to services for essential workers. Along those same lines, I think there are questions being raised about how do we define and determine who are considered essential workers, and how do we identify also the providers who will be tapped to provide those services. I think, we're hearing from folks that some child care directors have been asked to provide this type of service, but they are grappling with issues like families not having all of the application information that they need to be accepted into services, as well as identifying staff who can, continue to come and be on hand to provide those services. And then finally, looking for additional guidance about providing safe care and reducing risk to the extent possible. We also are hearing questions and appreciate the information, Jenna, that you shared about access to food, meals, nutrition. There is a great deal of concern to make sure that families still have access to those food services and to food security during this crisis. I think those are the broadly the themes that we're hearing most. I don't know if Jenna or Barb or Sharon, if you want to provide any further response at this point to those types of questions, would be glad to hear that now.
Sure. I think generally speaking, those are things that we're hearing too, Kathy, and I agree that that are both the issues that are most pressing and have bubbled up, and I think kind of across our programs are looking at how to respond, and get guidance out there. So I think as I heard that list and was quickly taking notes, many of those are covered in the guidance that's forthcoming, from licensing, from subsidy, as it relates to the more guidance coming on the food and nutrition, and coming as it relates to some of the other preschool programming. But it's it's good to hear that these are the concerns and that the ones that we're seeking to tackle. And I think, in terms of next steps, we are urgently trying to get this on, sort of written up and out and available. And then I think we have, two asks for folks who are listening to this. I think one of which is, let us know what works and where there are gaps, right? I think we think of this as phase one, right, in terms of response. We're trying to be kind of as comprehensive as possible, but, again, this is rapidly evolving. And so giving us that feedback, would be extremely useful. And then I think the second piece is to kind of help distribute that. So again, I think, just because it's posted on a website doesn't mean it will kind of get out to everybody affected. And so really needing help from our stakeholder groups, our kind of local organizations across the state to disseminate. One last ask too, and is again, we need federal relief, right? Again, this is an unprecedented national pandemic, and we know that national advocates have been pushing for kind of guidance on the block grant, guidance on sort of massive expansion of the food programming, kind of moving sort of things like paid leave, right? If we're really trying to close most programs that are not serving essential personnel. And so really needing that advocacy to get as many resources to support the duration of this crisis will be critically important. But I speak for the team and sort of saying these are the issues that are coming up. We need to provide written guidance. I think we're looking to do that as soon as possible. And then we seek you all's help and feedback on that guidance, dissemination of that guidance, and that continued advocacy for resources, because this is going to be a long one, and we're going to really need to support our providers, our first responders, our educators, our families, and our kids throughout this pandemic.
Thank you, Jenna. As we prepare to close, I just want to mention that the foundation is committed to continuing to request and offer additional briefings like the one today, if that is useful for both the state agency leaders and for our stakeholders over the coming days and weeks as a resource to kind of stay up to speed on the most recent information. I will say that with such strong leadership from the Northam administration and from the Virginia legislature, the Commonwealth has taken recent steps to strongly support increased access to quality early childhood services and a state structure as a backbone. I mean, no one could have ever anticipated this type of crisis situation that would add now a critical layer of complexity to how we're able to live into that potential. And now is certainly the time to bring the kind of focused attention that we're seeing happen, to offer resources and to join together to find solutions in the midst of this critical environment. I want to thank Barb, Sharon, and Jenna again for sharing information today and for your ongoing 24/7 work to make sure that these services and supports and resources information are available to our stakeholders across the community. Thanks to Julie Murphy for being on the call today to learn and to share that information across community mitigation strategies. And appreciate very much the stakeholders who will be listening to this message and who are working hard to ask the questions and share the information and provide vehicles for really understanding the types of actions that can be feasible on behalf of our children, families, and to early childhood professionals across the board. Thanks to everyone, and we'll look forward to providing updated information as it becomes available. Thanks again for your participation today.